Hello, my name is Dr. Dave Harper from M.O.S.A.I.C, and today's video is going to talk and address the issue of sciatic pain. Many people have sciatic pain, but also many people are misdiagnosed with their sciatic pain. Sciatic pain comes from an irritation either in the spine from a disc type of issue or down through the piriformis, which is a muscle in the side that rotates the hip. There's a muscle that can actually compress it, and I'll never forget when I was in my chiropractic education back in the 1980s. Our anatomy professor talked about the differences around how you and I may have different exit points for our sciatic nerve. Sometimes they come above the piriformis muscle, underneath the glute max and behind in the buttock area. Sometimes they can come within, and sometimes they can come out below. And he said if anybody wanted to volunteer for an autopsy, we'd be able to find out which one you had. But no one actually volunteered for that, of course. But it was just a good little joke, and his name was Dr. Duckworth, and he was just a wonderful, splendid physician. He taught us the anatomy back when I was going through school. But sciatic conditions are ones that actually are posterior thigh in origin. The pain, the distribution that we have down that sciatic nerve as it comes down from the back side of the buttock area, goes down the back of the leg. Oftentimes, people can misdiagnose it because they may have lateral thigh pain. That's a different condition that we'll talk about in another video called iliotibial band syndrome. But sciatic comes from the irritation, again, of the sciatic nerve that comes through the buttock area and down the back of the leg. It can go down into the foot. It can cause numbness. It can cause even a bit of a foot drop. It can cause trouble in being able to stand on your toes, trouble being able to stand and walk on your heels. These are tests that you could be doing to see if you can stand on your toes and walk with one toe to another. That's a good sign that things are okay, that there hasn't been any wasting of the muscles in the calf. If you're able to stand and walk on your heels with your toes in the air, that's another good test to see how the front part of the lower limb muscles are actually working, the anterior tibialis. And these are good tests to begin to see what's going. Some of the reflexes may be gone. The Achilles reflex may be in challenge. Sometimes even the patellar reflex may be in challenge. But when you have a sciatic problem, we want to make sure that it's also not being mimicked by the hamstring muscles. So the hamstring muscle and the other muscles of the pelvis and the posterior part of the pelvis can actually cause a referral pattern that can mimic it. Trigger point patterns, we call them, are patterns that Travell identified that could actually mimic a sciatic nerve. So we want to make sure that we've identified what it is, because the most serious complication that can lead to a sciatic problem is a disc bulge in the lower back. And that can become something that's a bit more difficult to handle. And at the extreme may even require some surgical interventions to help. We don't like to have to do that if we don't have to, but sometimes that's what's necessary to make a change. And we're open to that opportunity if it makes the best choice for you, the patient. But we want to make sure that we understand that. So we'll look at the hamstring. We want to do some different types of checks. We want to make sure that there's no pain when you're bearing down for a bowel movement or when you're lifting something. We want to make sure that we understand just exactly what's going on. We may want to take and have an MRI taken or some type of diagnostic imaging, x-ray for sure. We want to make sure that there's no arthritic changes in the spine. You want to keep your spine healthy and mobile and moving and healthy. A healthy spine does not actually become arthritic. That's a whole other topic that we'll talk about again in another video. But for the sciatic, we want to make sure the hamstrings looked after, we look at the hip flexors, we look at all these different structures, and then we adjust the spine. It's a very common problem. It's one that really becomes quite impactful into a person's life. And here at M.O.S.A.I.C, we have some great strategies and some very light adjusting techniques where we use computers to actually help create mobility and very gently and very cautiously and very directed with intention bring your body back into health and wellness. So listen, if you have sciatic pain, give us a call. Call the number that you see at the end of this particular video, and let's have a conversation and see what we can do about it.